COPD.
I prefer emphysema.
It's time for Stages of Life Radio with Dr. David Klein. Have a medical question? Call 407-422-1212. That's 407-422-1212 or text 23680.
Hey there, welcome to Stages of Life Radio, brought to you by Stages of Life Medical Institute.com. Well, we are, yeah?
Pretty much, yeah.
Let's turn down this music and get to business. 407-422-1212. Today, Dr. David Klein will be taking your phone calls and your texts, 23680. And also, I want to talk about your medical and nutritional regime.
Yeah.
Sounds like fun.
There we go. So, yeah, what I wanted to chat about before we start taking calls and this kind of stuff, and in fact, we are live right here every Sunday from 4 until 5 p.m. or thereabouts. So you can reach us at 407-422-1212 or text us at 23680 with your questions. So the texting is actually a little bit easier for me because then when we get a bunch of questions that are similar, I can kind of lump them all together and answer them all at once. What I wanted to talk about, because people ask me, well, what kind of doctor are you? What do you do? Well, okay, that's not an easy two-sentence kind of a thing to do. I'm trying to find what my mission statement is. I'm trying to figure out what it is that I do. And so I wanted to try to clarify it a little bit. And what we do at Stages of Life Medical Institute, mind you, it doesn't say Klein Institute of Technology. Okay, I don't need it. Don't need my name on the door.
Fair enough.
Okay, but what we do is we customize a medical and nutritional regimen for the patient. It's rather individual, very, very complete, very thorough, using a state-of-the-art precision diagnostic lab experience. What does that mean? It means I've got my own lab. Very, very cool, because it allows me to do something that most doctors can't do. And that's to sit back and when you find something interesting, if you keep an extra tube or two of blood, you go ahead and you run with it without having to drag somebody in the office and either waste their time, stick them again, or do what you need to do in order to figure out what's going on. That is something that I'd never had before I developed this laboratory business. And it's very interesting. So we've got molecular genetics capability. We have mass spec capability. So we can do toxicology. We can do lots of different things that are really not found in the average doctor's office with a tabletop cholesterol machine. It's just the way it goes. So we figure out using traditional medical approach. I have an MD after my name. I have board certifications on my wall. And what does it mean? It means that I understand something about mainstream medicine. I've also got credentials with regards to functional and integrative medicine. Those are a little bit different credentials. And then I read like a fiend. So what have I done? I've really created sort of an interesting little network within one building, one roof, to deliver comprehensive health care in a means and manner that you're not going to find anyplace else in this country and probably not anyplace else in the world. And the funny thing is, it's with one doctor. That's a little wasteful maybe. Okay, I'd love to find somebody else that I could teach, but it's not always as easy as you think. Finding doctors willing to listen is not always so easy. So what's the deal with precision laboratory diagnostics? And you're going, well, that's what they do right now. I go out there and they draw 3 tubes of blood and they tell me my cholesterol. They have all these things that I don't understand. And then they tell me I'm okay, even though I feel like crud. Well, if you don't look under the rocks, you don't find the creatures. It's the way that it goes. So the standard lab work that's done by most physicians, including me up until about 30 years ago, was to do a metabolic panel, a CBC, a urinalysis, maybe, and a lipid panel. That's about $22 worth of lab work. You're not talking serious money here. And yet, that is what is done. Well, you come in once a year and we're going to check your triglycerides. And if they're elevated, we're going to give you something, then bring you back next year. The funny thing about wear and tear is the longer that you go with a tire that's out of round, or the longer that you go with one that may not be aligned properly, it does damage not just to the tire, but to the suspension and onward throughout your vehicle. So you have to get on these things. And the older you are, the more frequently you need to be looked at, not just once a year. When you were 22 years old, you didn't have to go to the doctor at all. It's nice to get a blood pressure. It's nice to get a urine to make sure you're not diabetic. We'll see at 25 years of age because odds of picking things up at that age are very, very small. Once you hit 40, it starts getting interesting. Now, in terms of human history, it's been fairly recent, like over the last 125 or 130 years, if that, it could be less, that we've been living longer than an average of 45 years. In I think it was 1932 or 33 when they came up with Social Security, they were expecting people to be dead largely by the age of 50, 55. It was unusual to live to 65. So giving somebody a carrot, a reward hitting 65, was almost a fool's bet. We're going to take your money for your entire career, your working career, take it from your employer also, and promise you a little bit of a pension at the age of 65 because you're only going to live until you're 52 anyway. And this was mostly due to infectious disease issues, and then heart disease, and then cancer. Now what we're doing is we're finding people living routinely into their 90s and later, and yet the ravages of these chronic diseases are taking their tolls on the brain, the kidneys, and the other, let's just say, delicate parts that you have. So it's really, really important, okay, to go in and get checked out thoroughly. And that doesn't necessarily mean, you need to be MRI'd from top to bottom, stem to stern, back and forth. Nonsense. You just don't need that. But you really do need to check all of the systems, a systems check. So ask the rocket scientists, the aerospace engineers out at the Kennedy Flight Center. Okay, ask them. Okay, what's a systems check? And you're going to be there all day long because they're going to be going down through lots and lots and lots of systems. And when one doesn't check, what do you know? The launch is scrubbed. And they're scrubbed more times than they go up. Imagine that. All right. So what do we do at Stages of Life Medical Institute? We do this typically on a scheduled basis, which means that if you're over the age of 65, we'll see you every 90 days, sometimes more frequently, depending upon the circumstance, for blood work. What do we do when we check the blood work out? We don't just simply do the BMPs, the CBCs, and the happiness that most doctors do, but we look at your pituitary gland all the way down to your toenails in terms of diagnostic lab work. If we have to do cancer antigen studies, we do that. Looking at simple things saves lives. So we do ultrasounds looking for aortic aneurysms. We've picked up about 12 of those in the past 3 years. These are things that you do routinely once at least for men at the age of 65. So we've saved a bunch of people's lives with this. It's kind of an interesting approach to medicine, and that's getting ahead of it. Is it bad medicine? No, it happens to be very, very good medicine done under one roof. So why do I think that's important? Well, it goes something like this. I want you to consider the metaphor, of an HMO. That's an insurance company where they take your money and they promise you a gym membership, and then what they do really is they give you substandard medical care. They cut it back. You find, well, I can't get this done. I can't get that medicine. I can't do this, because they take roughly a third of what Medicare allocates them, and then they have to make money on the rest, which means that they turn you down. Fool's bet. HMO is a fool's bet unless you live under a bridge. Okay, you live to a certain age, you do not want to do this. But then you do the concierge medicine. Well, I'm going to pay you $150 a month, and then they find ways to not give you service. Or, well, that's not included, and you find yourself paying a bloody fortune for your lab work. Well, we do all that stuff at a deep discount, and we do it quickly. We do it effectively, and when you know it, we get the job done and get it done cheaper.
How do we get a hold of you? Because we're getting ready to go to a break.
We can be reached. Now, this is the best way to do it. Go on stagesoflifemedicalinstitute.com. and flip down. It's a marvelous little splash page. And what you do is you look for the new patient contact. It says new patient inquiry. You click on that. You enter demographic data. How do we reach you? And then what we'll do is we'll go ahead and take your data after you agree to allow us to do it to find out what your insurance coverage is. What's it going to cost me to do this? We'll be able to tell you. We need the data in order to do that. And we have those wheels pretty well greased. That's stagesoflifemedicalinstitute.com, new patient inquiry.
All right, we're going to take a quick break, pay the bills, and please support our sponsors like Pharmacy Specialists.
Good people.
Oh, they're great people. Yeah, they take care of you. They're a compound pharmacy. More details coming up on that. Stages of Life radio show will continue in a minute. We got a couple of people lined up on deck for the phones.
Excellent.
Text us 23680. We'll be right back. You're listening to Stages of Life radio on News Radio WFLA Orlando. All right, hey guys, thanks for joining us today. I appreciate everybody that's watching us on the internet and taking some time out of your afternoon for us. Also have Joe online. He's got some pre-testosterone numbers or something.
Cool. Let's get a look.
Yeah, that'll be fun. So we can take Rob in a little bit here. And let's see. Yeah, apparently the sand spur is still a problem.
Well, it's going to be a problem. You know, have you ever stepped on one of those things?
Oh my
they
God.
hurt.
Well, yeah, and the worst part is when they're dried out. The older they are and the deader they are, the more they hurt.
Yeah. Well, that's just kind of the way nature does it, because that's where the seeds get released.
Damn it,
They
nature.
get nice and dry like that. They end up in your heel, and you start just tearing across your yard, ripping the thing out, spreading those seeds neatly so that next year it'll be even better.
Oh, yeah. Gosh, that's so fun, spreading seeds and stuff.
Spreading fun and joy.
Yeah, it's very true. Very true. Okay, so he's got these really big numbers for you. He's
Cool.
very excited. He wants to know if he's got
excited.
something he should worry about
All
or
right,
not.
let's see.
So,
Let's see if he can get excited. What you got?
Whoa, yeah, no, he's on the phone. We got to wait for him. Let's see, and who do we have? Any questions online here for us, folks? We've got about a couple of minutes here and a whole bunch of people watching. I guess they're just going to watch. Hi.
Which fine. Wait, we could call this voyeur radio.
I know, right? Voyeurism.
Yeah, watch in. Watch us on radio. Hey, that's actually pretty catchy.
Oh, no.
No,
That's why I
maybe
got on
not.
radio. I hated it when they started introducing the web cameras and stuff. Watch us do our job. Bust the illusion. Ruin it all.
You look like that.
I
I love it.
That's the first one.
I thought you were much more handsome. I've heard people say that. I'm thinking,
Really?
you have got to be kidding me. But thank you for the compliment, I think.
Most people don't. Then you're like, oh, you don't look exactly like I thought you would. And if what did you think? They're like,
Who does?
I don't want to tell you. I know, right? I mean, you make a visual. Your brain does that. That's why I love reading, because your brain does that. It creates the image.
It's kind of like
for you.
Dr. Seuss. Did you ever think he looked like that? Really, you would have thought that he had like these sprouts of hair popping out and tail or something.
And a star. And
Yeah,
a
he actually
sneaky-
looked fairly abnormally normal. A little weird. But, you would too if you saw these sorts of visions in your dreams.
I don't know what he was having. Maybe undercooked pork or something before he
I'd
went to
say
bed.
there were probably substances involved.
Something like acid. So 1 minute.
Yeah.
All right.
I go out west because I'll sit back and smoke peyote, and then I see my next set of characters. It would have to be something like
You
that.
think?
Yeah. I mean, creativity sometimes comes in a jar, and sometimes it comes in mushrooms. Who the heck knows? I shouldn't say this about him because that was a genius.
Recreational drugs. I am suddenly clearing my throat, coughing nonstop, and spitting up drainage. I think it's allergies. What to do?
Okay. All right. Now, when somebody comes in and asks that kind of question in the middle of a
35
COVID
seconds.
epidemic, the first thing you do is get checked for it with a PCR. In your case, you can probably do it with an antigen study because if it's negative under those circumstances, you are clean. Then we deal with allergies. But yes, it can be. It could also be a tonsillar stone. There are lots of things that will cause this, including things like sinusitis. So yeah, this is a case for a doctor. Yeah, wouldn't you know? But get an antigen
Check.
test.
I just realized. Uh-oh. All right, stand by. We're going to come back right now. Welcome back to Stages of Life Radio. Wow, I was just sending back a text message here. 23680. The question was suddenly clearing my throat, coughing nonstop, and spitting up drainage. I think it's allergies. What should I do, Doc? Oh, Dr. Klein?
Well, here's the real deal, okay? In a COVID pandemic, and somebody comes in and they're coughing up junk. Now, granted, this is allergy season, but we also have an awful lot of people that have COVID and don't even necessarily know that they have it. So the first thing you want to do before you do anything goofy is get an antigen study. Now, you don't need the PCR for this. The antigen, the 12 to 15 minute front of the nose thing. And if you are clearing and kicking stuff up, spitting things up, if you're negative with an antigen, you are negative. That's the way these things operate. At that point, we start thinking in terms of allergies, which is perfectly reasonable, but we need to make sure that you don't have a tonsillar stone, because that can make you cough like crazy. Make sure that you don't have something like subclinical Parapertussis or pertussis, whooping cough can do this. And you can have sinusitis that'll do it. There are a number of things that'll make you do this.
The one thing, though, that COVID is different from this is that a COVID's more of a dry cough, so this meaty cough for the most part.
But not necessarily. Okay, when I got COVID, and I did, when Tess got COVID, and she did, my wife, there was a dry cough that followed. But while I was in the middle of this thing, there was anything that happened. It was kind of like the consistency of honey was being kicked up. This was not a dry cough.
Sounds like my
day.
It
was actually more disgusting than that, and it's a miserable cough. But you have to be careful that you don't have other things going on. But the first thing you do under the circumstance is to get one of those Sophia antigen tests. You can go to CVS or Walgreens or whatever. This is what they use there, and get it done. We do it at Stages of Life Medical Institute. It's $75. Elsewhere, it's about $150. Now, if your insurance covers it, great. If it's Medicare, it covers it perfectly. But not everybody is so blessed. If you have Blue Cross Blue Shield, get your checkbook out because they don't seem to want to cover any of this stuff.
Looks like we got Joe on the line here from DeBerry. Joe, how you doing?
Yeah.
He's there.
He's got to be there.
He's
I can hear him breathing.
I hear you, Joe.
Joe. Earth to Joe.
Joe.
Wake up, Joe. Time to go to school.
Oh, Joe. All right, I was just going to read your question, but I can't do it without your numbers, Joe. No, it's Rob. That's why he's not answering, and he's from DeBerry. It's from Deltona. It's Rob from Deltona.
There we go.
Makes a big sense.
Hey, good afternoon.
Hey!
Yeah, he was being very polite.
He was. He was like, I don't know this Joe from DeBerry.
He didn't want to
guy,
step ahead of Joe.
I'm going to step on this guy's toes.
Yes.
Rob, I apologize, but let's go ahead and get on with this. Pre-testosterone measurement, you've got your numbers, and you want to ask Doc if there's something you should be worried about. Go ahead.
What you got, bro?
Oh, okay. Recent lab work, it says 35.9 PG/ml.
That's
I'm
picograms per
65
ml.
years old.
Yeah, right.
Yeah. Is that something I need to be concerned about,
What was it measuring?
What should I do?
Was it measuring free testosterone or total testosterone?
Yeah, free testosterone.
Okay,
yes.
it's not bad. Really what you want to look at to know whether you're producing or not is total testosterone. So what I do typically is I measure total testosterone. The free testosterone comes after you know somebody's sex hormone binding globulin. You do a little arithmetic in your head and you can calculate the free testosterone. So the number you've got there really doesn't tell the whole story. So what you need to figure this out, 1, total testosterone. 2, estradiol. You need to know your estradiol level. You need both of those things, and then I'll be able to step in and go, okay, this is what we need to do. Because what you're looking for is a ratio of the total testosterone to total estradiol, and that will tell you where you are with regards to production, destruction, and elimination. Looking at the free testosterone isn't nearly as interesting, nor is it as useful, because when you go to dose it, you can have a fairly normal free testosterone, but if you have a very elevated sex hormone binding globulin, okay, and you want to make a change with it, you really have to double, triple, or quadruple your change in order to make any difference at all. So get that data, my friend, and get it back to us. But it's total testosterone and estradiol. If you can do that, then I can do it.
You're golden.
Golden.
Now, tell me about this the Stages of Life, the new patient portal, and all this that you're starting here.
Well, it's not all that new. We've had it for a while, but it needed to be addressed. So my lovely wife and my graphics design gal, we have a full-time graphic designer, believe it or not, the only medical practice I've ever heard of that needed such a thing. Crazy. Yeah, it's really more of a it's a jobs program, you know what I mean?
Yeah,
So Tess is working with her to try to make this thing look and work a little bit better. And wouldn't you know, it does. So you go to Stages of Life Medical Institute, and it'll take you to what's called a splash page. And this is a menu, a directory, a laundry list of the different things that we offer. Some of them are interesting to some people. Some are interesting to others. Some are useful here, less useful there. But the one that I wanted to point your attention to is the new patient inquiry. Now, why is this important? Especially in time of COVID, because when you call the office on the telephone, okay, we're running short-staffed because somebody is almost always out doing this, that, or the other, or they're doing double duty because the other doctor's offices in town are not open. So if you go online and do this, we can find a break in the day and then call you back, get the necessary information from you, because we're not going to ask you for your insurance information on the inquiry. We're not going to do that. It's wrong. So what we do is we ask for your name, telephone number, and general things like date of birth. And then we'll get back with you get the information, explain to you who we are and what we do. It's a good idea. And then run your numbers for you. Find out whether or not you're eligible for free laboratory. If you're Medicare, they don't really pay much of anything for this. It's kind of interesting. It's about the major benefit that we've got. You can get world-class laboratory done. It'll cost you nothing. But some of the HMOs, you may have a $20 copay. If you have a regular Medicare, it might be $18 or it could be $40, whatever it is. But you're not going to be seeing these laboratory bills that can run up in $2,000, $3,000, $4,000. So we don't do that. So we check everything out and then get back with you. And that process takes about a day. So if you give us an appropriate email and or telephone number, I would do both. One of my gals, okay, it's going to get me into trouble. They're going to do Dr. Seuss to me. That's what they are. They're nice people. I treat my staff like family, not like they do in West Virginia, but I treat them like family.
More like New York
More
City?
like, no, not even like New York.
Okay,
New York, upstate New York. No, what we do is we are a very tight-knit group. And so one of us will pick up the ball and then get back with you. So it's really kind of nice. You'll be able to see all the different things that we do. But that's really how it's done. That's the best way to do it. And then we'll forward on to you by email, the new patient packets. The data that I ask for is not a simple matter. We do not do anything sloppy or halfway. I just have not been that way my entire life.
23 pages.
It's lengthy. I want to know everything about you because it's surprising, absolutely shocking, the sorts of things that get left out even in a 23-page document because the patient doesn't think it's important. And then we find out that they had some very, very interesting little ditty that explains everything. So it's rare that a new patient doesn't come through, that we figure out what's wrong, not based what's on the list that they think everybody needs to know, but it's on the stuff that they decided to omit because they didn't think it was important.
Right.
And the sense of humor really comes in handy.
Real quick, Doc, we got a follow-up question to the clearing the throat.
Yes.
The other question is due for the Pfizer second shot tomorrow?
Yeah, you bet. Go ahead and do it.
Proceed. Go on,
now,
do it.
Okay, here's the deal with this. They say, if you're sick with COVID, don't come in because you're going to have a terrible reaction.
That's not
the
true.
truth of the matter is, they don't want you to come in because they don't want you to give them COVID. It's like the old thing. Well, Mr. Jones, turn your head and cough. Now, you think that's doing something to the muscles of your abdomen. No. So that way you don't cough on the doctor.
Cough in my face.
Yeah, it's just so you don't infect them. So you're wearing a mask. It doesn't make any great difference. Go for it. But I got my inoculation about 12 hours before I found out that I had COVID. And it didn't make a lick's bit of difference except that I developed gamma globulin, the IgG, about 3 weeks faster than my wife did. And we both got infected at the same time. And I cleared, I'm 12 years older than she. I cleared the disease in 10 days faster than she did. So my advice is get the darn vaccine. Just go do it. Keep your mouth shut. Well, are you sick? No.
No.
So get the antigen after you get the shot. How's that?
Yeah, that makes more sense to me.
I mean, I hate to put the but say, well, but that's really what it is. They do have a tendency to stretch the truth. The government does.
407-422-1212. Stop making sense.
Yeah.
I know they do. Or hashtag, what is it? Not hashtag. 23680.
Hashtag I'm from the government.
Yeah,
I'm here
right.
to help you.
Hashtag I'm the government. 23680. We're going to check the bottom of the hour news in just a moment here, and then we'll be back in a second. But
there's a really good one right there by Annie, and we'll get back to yours in just a second.
Yep, 23680. Annie checked in on the text line,
Cancer
and you can
antigen study.
too.
Good question.
Stages of Life, medicalinstitute.com. Go ahead and check out that new patient portal that Doc was just talking about and get set up as a new patient at Stages of Life Medical Institute. Like I said, we're going to take a quick break. We'll be right back. Stages of Life Radio on News Radio WFLA Orlando. Which I never do very well.
There we are.
I know. I got the lot. Wait. Is that right? Yes. No. Tell me. Wait. Yes.
Ah, right.
Right. I'm not right. I can count backwards from 60 though.
Can you really? By sevens?
Yeah. No. 3.
Yeah, we used to ask people to do that as a neurological test.
It is so dumb.
No, well, no. Actually, the best part's when you're doing anesthesia and you're inducing them, and you tell them, "Can you please count backwards from 100 by sevens?" They go,
like,
"What are you talking about?"
They
Out
go,
they go.
93.
Out they go. Yeah. So I stopped doing that. When I used to knock people out for a living, and so I would always say on their way out the door, which is another way of saying your eyes are rolling back, I'd say, "You're going to pay your anesthesia bill first." Bam. Out they go. Subliminal message. Did it work? I don't think so, but
Probably
it was worth a
not,
try.
no, probably not at all. So, any questions while we're on? Oh, thank you, Mikael. Greatest doctor in Orlando, I hear. That's what.
Well, thank you. I appreciate that.
Yeah, or Michelle. I don't know. It could be Mitchell. It's hard to
You
say.
never know.
Don't.
He might have been paid advertisement.
It could have been. Did you pay him?
I don't recall whether the check
It's
cleared.
about time for Rob to come on and say something like the greatest doctor in the world or something.
There we are.
Yeah, there it is. Greatest doctor in Orlando. Oh, please.
Yeah,
At
why
least
limit the
Central
geography?
Florida. Come on, man.
Hey, look, I'm a megalomaniac. Actually, I'm not. I wear a polo shirt.
Let me just clarify that your wife just shot you a look.
Yeah,
When
well,
you said
no,
that?
the last time I said
Really?
something like that, she kicked the lever on my chair and made
That
it
was
drop
so
a foot.
funny.
Oh yeah, it's kind of like
Total Freudian, unintentional,
Yeah,
but
so-
he went and dropped down about 3 inches.
so on the camera you could only see the top of my head and just the upper part of my eyeglasses.
You were demoted right then and there.
Very fast. That will teach you. We'll put you right where you
She
belong.
didn't even mean to do it. It just happened. But it
No,
was
it's
perfect.
reflex. She meant to do it. I'm convinced.
I don't know. She practiced for like 10 minutes trying to flip that thing before you,
what?
got here.
No, but I have to hide the scissors before I.
Let's see. Hold on. There we go. Ready? Welcome back to Stages of Life Radio. The phones are hot, Doc. We got
Good.
George on the line. Hold on. Let's see.
George. My old friend George.
George, 274. Hey, George from Orlando. How you doing, George? What's going on? What's on your mind? What's happening?
What's up?
He's got trouble swallowing.
How are you?
Well, thank you. What's going on there?
Okay, they asked me already, but my question was, in the morning when I take all my medications,
Yep.
there's some capsules like lecithin that are pretty big, and they kind of hang in my throat.
All right. Well, first thing,
I have a tough time getting them through.
let's start with lecithin.
George.
Okay. You never
Hey,
heard.
Doc.
Yeah, George. Good to hear your voice. You never heard me ever recommend lecithin.
Yeah.
And there's a reason for that. They're going to say, well, it lowers cholesterol. It also impairs thyroid function, puts weight on you, and does all manners of damage. Because the lecithin that you've got is made from soybeans. All right? Unless it says sunflower lecithin, which is very expensive, you wouldn't have it. So lecithin contains 2 isoflavones as impurities. One's called daidzein, the other one's called genistein, and they inhibit the conversion of T4 to T3, which means that your thyroid doesn't work real well. And it also, oddly enough, will inhibit 3 digestive enzymes, trypsin, chymotrypsin, and pepsin, which will make it hard for you to digest other proteins. My first recommendation with the lecithin is throw it away. If you need to lower cholesterol, I will teach you how to do it. If you need to do any number of different things, I try to get people to avoid lecithin at almost all costs. Now,
Hey, Doc, can I say one more thing?
yes, sir, what you got?
Last Thursday, I got my second shot for the
COVID?
pandemic at the VA.
Good.
I'm done.
Good for you, my friend.
George.
Yeah, George, you can now go out and date again. It's important. Yeah. No, George, you did a patriotic duty. Okay. Now I want you to think. You're a veteran. I'm a veteran. And one of the things, so Melissa's a veteran as well. She was an MP, so we speak slowly for her.
Starboard.
So what do we do? Well, in the military, during the Second World War, the greatest generation, they went into Normandy, they stormed the beaches, they went into all manners of Pacific islands, one after the next, wave after wave after wave. And many of those boys did not come home. But not one of them said, hey, look, I want to wait until the 4th wave just to see if it's safe. Okay, so there's a patriotic responsibility that we all have to get our country back on track. And if it means rolling up your sleeve and getting a shot, damn it, do it. Okay, it's one of these kinds of things that just makes me so angry I can't stand it. Well, I'm afraid to do it. I want to wait until somebody else does it.
Yeah,
What if you're a fireman? Oh, well, there's a fire down there, my friend. Well, I'm going to wait and see if the other guys can take care of it because I'd rather sit back and not run into any danger. There's a bank
I
robbery.
want to say about the VA, they are wonderful people. They treated me with respect and the way they should treat a veteran.
Well, you got it.
I can vouch for them. They are the best.
Good for you. And I got to say this. I was a VA doc for 4 years. Okay. And it was not always as much fun as it is right now. I got to tell you, but the folks out at Oviedo Mall, okay, Seminole County, they were outstanding. It was a 30-minute endeavor from the time that you touched the front door until you left. 30 minutes in and you were gone. And so, but I'm rarely impressed by anything that the federal government or state government, for that matter, touches. That was pretty awesome. And this fellow, DeSantis, the governor,
he's a good guy.
He's outstanding. I wasn't so sure about him. But, I am wickedly proud that he's our governor, and I've never said that before about anybody.
Hey, George, thanks so much for checking in today. If you got a question for Dr. Klein, 407-422-1212. And yes, the VA, good people.
Yeah, I mean, really, they are stepping up to it.
Oh no, they have definitely picked up, and that a lot of that had to do with the prior administration.
No kidding, it had everything to do with the prior administration.
Well,
but we can't say that too loud because if we do, they'll shut the VA down.
You
know what I mean?
Okay.
Well, that was Trump's idea, so we can't allow that to
Let's
continue.
see, we got one here says, and you knew this one, so go ahead because I don't know
so it's a breast cancer patient. Should she take vitamin D3? And the reason why she's concerned, this is Annie, is that her cancer antigens, the 27 and 29, go up when she takes the D3. That's an interesting thing to have happen. Vitamin D3 is generally very, very effective, very useful in breast cancer patients because it's an estrogen receptor blocker. So I tell my patients, take 5,000 IUs of vitamin D3 with a fish oil. But if your cancer antigens go up, I would be inclined to use that as a stimulus, some kind of a way to push things a little bit, and then get a PET scan to see if you have any nests of the breast cancer that you don't see. That would be kind of interesting. But vitamin D3 is an estrogen receptor blocker. It's not estrogenic by itself. So if you're seeing that the cancer antigens go up, it may mean that your immune system is being allowed to work more properly. So what would I do? I would take it and then ask my oncologist or gyno-oncologist, depending on how you're having this done, to go ahead and do this, monitor the antigens, which we do at Stages of Life for people like this, but then get a PET scan to see where the nest might be. This may actually reveal it for you.
I like it.
It's kind of an interesting problem. I like that kind of stuff.
Yeah. 23680, that's the text line. It's real simple to just ask your question. If you want to put your name on there or any more information, it's pretty simple to do.
Brilliant question.
Here's another one. Now, this person says they got both Moderna vaccine, the 1 and the 2, and now they're wondering if they should get the shingles vaccine. What's the window on that, Doc?
Well, usually you like to wait 2 weeks, sometimes a little bit more, 2 or 3 weeks. What that does is it allows the body to incorporate and to react to the first vaccine. 2 weeks is generally sufficient for most things. So what did I advise my wife to do? Wait 2 weeks and then get the shingles vaccine. Has she done it yet? No.
Oops.
Okay, because that's just the way that it works.
Call it out.
Yep, how it goes. I just got raspberries thrown at me.
Saw
She goes,
that.
No. But that's how we handle it. Now, I advised her initially to get the shingles vaccine back in November or December before the Moderna came out. That way that she would have had the ability to get it before the vaccine would have hit the market. But delay being what it is. Yes, go out and get it. So the question is, when did you get the second vaccine? Give it 14 to 21 days and then get the shingles vax.
So 2 weeks from now, you said. So, yeah, whatever.
Yep,
That's
that
a
would be
window.
it.
That's not bad.
No.
23680, wide open on the text line. Always. The phones are ringing. 407.
An interesting thing.
422-1212.
My advice to those individuals smart enough to go out and get the vaccine, all right, you're going to want to get quantitative antibody blood work. Now, this is covered by Medicare. It's not covered by about anybody else, but it's a $49 study at Stages, and you can find out how much of the IgG you have in your system.
And what does that mean?
This is important.
What's it mean?
Okay, when people get COVID, they'll end up running up an IgG level of between 2 and 3. Some people higher. I've seen it as high as 20 and change, but it's usually 2, 3, maybe 5, but not much higher than that. When you get the vaccine, Pfizer or the Moderna, I don't know about the J&J vaccine yet, those levels go to 20 or 30. So you're seeing the vaccine generate gamma globulin levels that are 10 to 30 times higher than if you got the disease itself. Now, why do you care about that? Well, if I've got antibodies, I'm immune. The answer is negatory, Batman. It has to do with how much antibody that you have on board. So the metaphor that I like to use is a styrofoam cup. So let's say that you got COVID and you're going to get a styrofoam cup full of gamma globulin if you're lucky. Then poke a hole in it with a pencil. It will drain out at an anticipated and a reasonable rate. It's predictable how long that cup will last. That's the way that it generally goes. So the inoculation gives you like a gallon's worth of the gamma globulin. So those individuals that get the disease may have immunity for 3 to 6 months. Those individuals that get the shot are going to have it for 6, maybe 18 months, depending upon the level. And the only way you're going to know is with blood work. So that's one of the things that we include with our routine lab work at the office, Stages of Life. We do gamma globulin levels for our senior patients. These are people that are over the age of 65 every 90 days. So we can tell you when you're going to need your booster, and you will. Don't you know? It's a brilliant question.
That is.
Yeah, nicely done.
I know I have a person hanging out on the line here, but I'm not sure we're going to have time to take it. Let's go ahead and give it a try and see what happens.
What do we got?
Carol. Hi, Carol. Turn the radio down. Yep. Carol. Turn the
radio off.
Radio down, phone to face. Hi, Carol.
Hello there.
Hey, how are you doing?
Hi, thanks for calling in today. It says here your 59-year-old son just finished radiation for prostate cancer.
Going to finish up this week.
All right.
Prostate cancer, and wanting to know how do you know it worked and what happens next.
Okay, well, there are a couple things that you're going to want to do with that. You follow the PSA level sequentially about every 3 to 6 months to see where it goes. Now, after the radiation, after surgery, after manipulation, after biopsy, the PSA or prostate-specific antigen is expected to go up. So it'll shoot up because you mess with the prostate, cells die, the proteins end up in the bloodstream, and wouldn't you know it, the level goes up. Radiation does the same thing. It's like burning the prostate. Going in there with a lit cigarette, and you're zapping that prostate, killing the prostate cells. Radiation is heat. Basically, it's energy being delivered. So you wait several months, and then you recheck the PSA. You wait several months more. You check the PSA after that. So I usually check it every 3 months on my prostate cancer patients. Are there other labs you want to get? The answer is affirmative. You know, there's one called CEA, which is a type of protein that you'll sometimes see with metastatic prostate cancer. We'll look at something called bone-specific alkaline phosphatase, or BAP, and that will tell you whether you have metastasis to the bone. So we do these things pretty routinely. BAP, it's bone-specific alkaline phosphatase. So I mean that's a mouthful. I don't know.
BAP.
Yeah, I don't know how to help you so much with that. But the question you're going to have is how do you know that it worked? Well, because he's going to start finding it easier and easier to pee. The number of times he has to go to the bathroom at night is going to start to drop off, and he's going to start to feel better.
There you go.
That's how you know.
All righty then. Thanks for the call, Karen. Good luck with all that. Hey, we'll be right back at Stages of Life Radio, 407-422-1212. You're listening to News Radio WFLA Orlando. Yeah, this is a short one, like 2.5. Set my clock here. That was fun. You doing okay?
Oh, I'm doing fine. Yeah, these I'm getting pressure ulcers from these headsets, though.
Because your head's back.
No, somebody wore these before me with a small head. I'm convinced.
Mm-hmm.
I think I wore it.
I am not even. I got nothing for you. Like 46. Oh, I didn't have good. That's
Maybe Dr. Ken was sitting here before me. He's got a small head.
By the way, thanks for embroidering my. Did you see what she did?
Tess?
Yeah, Tess. Thanks for embroidering the cable to the other one. It was crochet. Well, you weaved the cord? She weaved into latching circles for me like some Girl Scout projects. Very, very clever indeed.
Yeah, she weaved a pot holder for you out of your microphone
I know.
cord. Where's all the static coming from? Somebody bent it up.
Somebody made a pot holder out of the cord. It's okay. You're fine. It was kind of funny, though. Anyway.
Yeah, it meant to die an early death anyway, so we just took care of it.
I did.
Yeah.
To cover my tracks.
Yeah, I can't. It's like I'm like, oh, Tess. Well, she'll take I leave little twisty ties around. I come over and it's in the shape of a guitar and microphones. And
Oh,
I'm like,
it's
wow.
awesome. Well, it's like when Lizzie, last Tuesday for our Thursday night show, I was sitting there weaving her microphone, playing with it. So until finally she started looking to kick the lever on my chair to make me go down. I'll get his attention. Boom, down he goes. Yeah, it's tough being the only guy in the studio.
It is. So we got about 45 seconds here for the people that are watching us on our social media pages. They've now in Florida lowered the age to people who have comorbid. Let's face it, fat people,
50 years
and
old,
sick
and
people.
if you're sick, you can get the COVID vaccine if your doctor fills out a particular form issued by the state of Florida.
Exactly.
So at Stages, we went ahead and incorporated it into our healthcare record so it can automatically populate if you qualify and if you have an appointment there.
Aha! So there you go. So yes, you can now if you're older.
And Papa's got a brand new bag.
He does.
James Brown was one of my heroes when I was growing up. Papa's got a brand new bag.
Welcome back to Stages of Life Radio. It's our last segment for this Sunday, so I hope you're getting all the information you need, folks. Text line 23680. It's Melissa Fox along with Dr. David Klein. Stages of Life Medical Institute.com. Go there and fill out the new patient portal forms and get the ball rolling, right?
Yeah, there's new patient inquiry. That's what we call it. New patient inquiry.
Fancy.
Yeah, it does sound fancy.
Now, is it inquiry or inquiry?
Well, it depends on where you come from.
Inquiry? Inquiry.
It could be either. Potatoes, tomatoes. Yes.
Yes. Potatoes, tomatoes.
Inquiry.
What? Okay. All right. So anyway, go there to the new patient portal and fill out an inquiry and get the ball rolling. Is that better? Stages of Life Medical Institute.com.
Well, it's not the portal. You're actually going on the internet page. Now, we do have a portal, but you have to already be a patient to use the portal. That's the difference. Is it a subtle difference? The answer is yeah, it is kind of subtle. However, the people that are not patients yet understand how this works. Go to www.stagesoflifemedicalinstitute.com. This thing pops up with all of our different offerings, and then just look for new patient inquiry.
Directory.
It is a directory. Well, you were the one that actually helped me put it together.
I know it's kind of kooky.
Yeah, there is. Quirky is better.
Quirky. All right. So anyway, we started out the show talking about medicinal and nutritional regimen.
Yeah.
And how Stages of Life, state-of-the-art lab and whatnot can help you get it done.
Yeah, it's because otherwise you are shooting in the dark. And so here's how it goes. Well, you've got elevated cholesterol, so we're going to give you a statin, right? That's the typical approach to it. If that chemical's out of whack, we're going to give you something that poisons the enzyme that presents and makes that chemical. When in fact, it's a whole lot more elegant and a whole lot safer and a good deal better medicine to figure out why the cholesterol goes up to begin with and deal with the underlying issue, which is almost always a different type of morbidity, either hypothyroidism or a gonadotropin issue. Let's say that you've got diabetes, your blood sugar went up. Without knowing what your insulin level is, you don't really know how to treat it, do you? Because the problem may not be insulin at all. It may just simply be the receptor. And that is a complicated matter to try to fix. And when you do, wouldn't you know it? The insulin level drops, the blood sugar drops, and the A1C drops. So in my office, it's considered a failure if your A1C is over 6. Now, if you look at the advertisements on TV, well, I took my Ozempic and my A1C is under 7. How joy and rapture. That would be a profound failure in my practice.
Yeah.
No, the 7 sucks. Okay, it might be good for them, but it's not good for me. I like to see it about 5.5 to 5.7 or lower. Now, what is hemoglobin A1C? It's not just a number. What it means, it's glycosylated hemoglobin. This is where the sugar goes. It sticks to things, makes the red cells a little bit stiffer, but the real damage is done to the inner lining of the blood vessels. So glycosylated hemoglobin, or the hemoglobin A1C level, should be under 5.5%. That's where you want it to go. Well, what else can cause many of these little aches and pains that people come through? Uric acid issues. It almost never gets checked anymore. It used to be a routine thing. Then when the insurance stopped paying for it with the BMP, the basic metabolic profile, they stopped ordering up uric acids. Well, I want it. I want the data, and I pay to do it. So I get it, and wouldn't you know, these are the arthritic issues that people have. If you don't know what's causing the arthritis, you can't fix it. So what am I going to do? Give you an anti-arthritis medicine or correct the uric acid level? What does insulin do? When it goes up, it causes arthritis. It causes inflammation of every tissue in your body. So if you can bring the insulin down, the arthritis pain gets better. Your fibromyalgia patients, well, what causes it? It has no known cause. That's fibromyalgia. Nonsense. Everything that exists in the universe has a cause. It's up to us to figure out what it is. So what's the number one cause of fibromyalgia? Hypothyroidism. What's the number two cause? Hypoadrenalism. Then the list gets a little bit thinner. What about things like dementia? So you just don't simply say, well, grandma has Alzheimer's. There's no cure, no control. There are, in fact, treatable causes of dementia. My most favorite one of all is urinary tract infection. Chronic urinary tract infection causes symptoms that look and stink like dementia. So how would you like to spend the last 10 years of your life with a subclinical urinary tract infection that's treatable with a week's worth of Levaquin and end up in a high-cost memory care unit because you have a urinary tract infection? That is not the sort of thing that I would want happen to me.
So how do we rectify this? Because we got a call we need to handle it.
Okay. Well, the way you do this is you get evaluated, and we check every senior. That's even people younger than me. Okay, that's 60 years of age, 55 to 60. We check every one of them when they come through for a urinary tract infection. That's the way it goes, and you pick this up. About 20% of the people floating around that are asymptomatic have a florid or a regular detectable urinary tract infection. When we use our $6,000 UA machine, 1/3 of the negatives actually have detectable urinary tract infection by molecular genetics diagnostics. So we're picking stuff up that I would never have believed in a million years existed out there.
Hey, Rick, checking in from Altamont. He's 73. So you want to know about the side effects of the shingles shot. How you doing today, Rick?
All right, I've heard some pretty bad things about it. There's one other thing I wanted to ask him about, too.
Sure, go for it. What bad things have you heard about the shingles vaccine?
Oh, these people had days and days after they felt just awful, really.
Okay. Now, here's the deal. Okay, shingles as a disease really, really stinks. Okay, it is a misery. 1/10, 1 person in 10 that gets shingles will have pain for the rest of their life. It's called post-herpetic neuralgia. I get stuck with these patients dealing with their pain for the rest of their life. They have to see a guy like me every 4 weeks or so to keep their medications going because there's not much you can do about it. Somebody comes down with shingles acutely, you stand a chance by intervening quickly, but most people don't even necessarily know that they had shingles. So subclinical shingles is very, very real. The second thing about shingles is you can get it more than once. And it's not as uncommon as you might think.
More women get it, I've heard.
Well, I got it. I don't consider myself to be a woman.
Terry Bradshaw suffers from it. He's not a woman.
Yeah, it happens.
I would call him that and see what happens.
Yeah. So I got it when I was getting divorced. The stress apparently was what may have set it off, or it could have been the fact that I was
usually stress
dating again. I don't know what it was. But something set it off with me, and I ended up with the shingles. So I knew how to treat it. But what would I do? I'm planning to get the shingles vaccine when my wife does. She's going to be going in as soon as she can get to Publix, okay? And I'm getting mine. Now, this is how it worked with the flu vaccine. All right, I went in there. I got it because she was, I can't get around to it. I'm too busy. I can't this, I can't that. Get the damn shingles vaccine. There are whiners out there. There are people out there with nothing else to do but whine. My arm hurt.
Zastovax, I've heard, it doesn't have as many side effects.
Yeah, well, just get whichever one you want. Okay, it's a matter of choice. Some people.
I have one other question about EMFs. I'm not convinced one way or the other. I live in an apartment complex, condo complex. I got a bunch of boxes, smart meters outside the window. It's covered by a board, though. But I'm not convinced one way or the other. They say it's harmless. Some say it's not. And I don't know who to believe.
Okay, well, if it were a thing, you'd see more dead people. You'd see more dead animals. Okay, you don't see any problems under the high tension wires. Okay, the cattle graze just fine out there. But they will run, they will go nuts if they can sense that an earthquake's coming. So if there's a problem, I would trust the animals.
Get the shingle shot.
Get
You
the
just
shingle
texted
shot.
in
Just
there
get
as
it.
well. Just get it. Hey, we got to go, Doc. Say goodbye.
Well, it's good to be here, and have a good, happy weekend. What's
I'll
left of
see
it.
you tomorrow morning.
Yep.
You've been listening to Stages of Life Radio with Dr. David Klein. Check out stagesoflifemedicalinstitute.com or stop by 1917 Booth Circle in Longwood near the intersection of I-4 and 434. Call 407-679-3337. That's 407-679-3337. Dr. Klein accepts most insurance and Medicare too. Join us next Sunday at 4 p.m. on News Radio WFLA Orlando.
This hour, we're having a salute to a recording artist who says that his biggest source of inspiration was the airwaves, Stevie Wonder.
My greatest influence was radio. It was my greatest friend in that I was able to go many places just sitting in my living room. And even more than sitting there and going there, I could imagine them to be any way that I wanted to see them as being. And that's somewhat the disadvantage sometimes of television, because it doesn't leave anything to the imagination. You just... there it is.